So the first thing, just SNDA updates. We have the senior banquet, which will be on May 18th, and it'll be at 7 in Anne Arundel Mills at the Hotel at River Preserve. And tickets are still available for friends and family for $50 and $75 for faculty and any alumni who are interested. And the link is in the PowerPoint, but also it's in our newsletters you get every week as well. So we have, next week we have our chapter elections on Wednesday at noon. And I put up the current nominations that people have nominated individuals for what positions they're interested in, and also the open nominations. So if you know any D1s or D2s who are feel like will fulfill these positions well, nominate them. And then the Google Doc again is on the newsletter that you get every week. And finally, introducing Dr.
All right. So now that your tummy is full, some of you, let's see, is that thing on? Okay, good. One of the things I want to do, some of you who I've met before and know, like to take a quick group picture. So otherwise, I think what's going to happen later on, we'll one at a time, and I don't want to miss my train. I have to go see the tooth fairy. All right, so let's see how this works. Yeah? All right. I would say smile, but I can only see a couple people in the front. But that's okay. I got somebody in the back got their hands up like they're on a roller coaster ride. I love it. All right, 1, 2, 3. There it is. All right, cool. All right, let's see. How do I get back? Close your eyes, okay. Oh, close your eyes. Close your eyes, everybody. Okay. How much time do we have? An hour? Huh? When's my train? You guys see in the back? So it's good to be back in Maryland. Even though when I was here, this building was not in existence. There was talk about it, but had not been developed yet. So it's great to see all these new technology and how the room is set up with the computers and stuff. But it's good to be back here, see some familiar faces and some new faces, like the ones that picked me up in the train station. So, I think these next 50 minutes or so that we're going to spend together is going to be really valuable and a lot of good information, especially for the D2s and D3s. Just a quick show of hands. D2s that are here in the front row, okay, and a couple more in the back. All right, D3s. All right, cool. I know some of the D4s. You guys are knocking on the door, getting ready to get out of here. Right? So thanks to Maryland Dental Society for setting this up from last year when I came down, SNDA, and you guys know who WSGB is? No? Who? Gardner Brown. But she's also, before she was Gardner Brown, she was Sproul. That's our secret. That's our secret. Miss Brown also. So Maryland, we have a lot of big history here in Maryland, not only in the first dental school in the world, but one of the schools that have a high graduation rate as far as those that are of underrepresented minorities, right? And you guys are living that existence, that history right now. So I would say not too dark. It may not be. Well, we'll see. You can turn them up a little bit. Can you guys not see in the back though? It's better now, but was it lighter or better? Was it okay without the lights? I mean, without the lights.
It's better now.
It's better now. Okay. All right. So there's a few of you that I know me, but I think for a couple of people, this is probably the first time that we've met. So what I'll do is to kind of make it go a little bit faster and kind of move the content along. We'll insert here. So currently, I serve as a program director at Bronx Lebanon. Involved in organized dentistry, also at the education level. Some of you might have been involved with the DIA and maybe as a school rep or something like that. I know Dr. Morgan, as a faculty member, is involved with the DIA. New Dentist Conference, the NDA, National Dental Association, has a new dentist conference, which I encourage all of you to participate in as you all transition from SNDA members into new dentists in that organization. Just recently got selected to be a site visitor, and Dr. Morgan and I were just talking about that, as far as dental schools and postgraduate programs go through accreditation to maintain their status. And a couple other things that I do, but pretty much right now, my passion is helping you all as new dentists. All right, dentistry is a great profession, but there's also a lot of things to be learned. So we're going to talk about a couple things as relates to this person right here too. You guys know who this is? Yeah. Does everybody know who she is? Are you sure? Okay. Because I was down at Howard and maybe only like 3 people knew who she was. So, well, I know, but hey, you never know. But I point this out. What about this number? What does this mean? Anybody have any idea what this number is? This is more geared towards the D2s. Where the D2s at in the front? Right? This is a special number for you guys. This number right here. For the D3s, it's 394. What'd you say? Days until graduation. I mean, not that anyone is counting, but I'm just saying. These are days until graduation. Right? But before you guys get to this point here, there's some things we want to talk about today that helps you plan for what's going to happen after graduation. And that's what we're going to be talking about today. So we're going to talk about 9 reasons why, in my opinion, postgrad residency is not optional. Okay, it's not optional. So these viewpoints that I'm going to share with you guys tonight are mine, based on my experience as a dental student, as a resident, in being in the military, private practice, but also being a program director too. Okay. So a couple of rules. All right, this is meant to be interactive, and at the same time, we want you guys to participate. So we have some things we want to have you guys do. Also, I need to get 10 people to put their hands up real quick. That's quick. What's that V on your?
You know.
I don't know. We'll see if you know what it is. Hold on, we'll see. It's got bling on it too. Alright, thanks. So some rules for participation. So for all of you that got a number, when you see your number on the screen, I want you to stand up, state your name, what year you're from. I mean, what year you're from. Where you're from. D3, that's where I'm from. State your name, where you're from, and what year. Okay? So the objectives and purpose, we're going to talk about why residency training is not optional. We'll learn how postgrad training impacts and kind of influences your professional development and success. Give you guys some tips on how to boost your credentials and add to your current credentials as relates to residency programs, but also as relates to employment opportunities. And give you guys a call to action. But again, my purpose is to help. My goal is to help as many new dentists as possible. All right? Anyone know who this is? I know we have some track people in the room here, I heard. But this is Usain Bolt. So my goal is kind of bolt through all this content so we can get towards the end of the presentation. It's going to be a question and answer, a Q&A. Because I think you guys will have a lot of questions as it relates to some of the things that I'm going to present. Okay? Anyone know who this is? I mean, it is Thursday, right? So this is Throwback Thursday. That's me. That's right. And Dr. Morgan, I do not drop the baton.
Unlike USA.
Huh?
Unlike USA.
All right, so let's get started. So number one, who has number one?
My name is Chidi, aka Anthony. I'm a fourth year dental student. I'm from Nigeria.
Okay, cool. So, Chidi, what do these two numbers have in common? 8 and 300,000. They're even numbers. Okay. What else? He's got a Nigerian block right now. Can anyone help him out? The two numbers, 8 and 300,000. No, you go.
Okay, great. So 300,000 is probably the average amount of debt that one graduates from dental school with.
Okay.
And then 8 is, I want to say, the number of 4 years you spent in dental school and possibly the 4 years that you spent in your undergraduate career.
Awesome. You're right. Ding, 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 ding. All right, so 8 years of schooling and 300,000. Yes, you can hear that. You're right. 300,000. Now, keep in mind, what's tuition here in Maryland? What's it on the year?
This month or like
For the year. It's what? So that's in-state. Where are the out-of-state people? I know there's some out-of-state people. About 100?
You're talking about fees or just
To be here, to be in class,
So
everything.
for out of state, it'd be 108, and now for in state, it's about 85.
All right, so this number is a little bit above the average and definitely below what you guys are paying here if you're out of state. But the average usually is about 274, 275 based on some data from Medea. But regardless of this number and this number, the main thing to take home is it doesn't make a difference. These 8 years and this $300,000 doesn't make a difference. Why? Because it's not enough. It's not enough. You guys are going to be spending more time investing in yourself and your education, and you're going to be spending more money to do so as it relates to building your practices, but also in spending money for continuing education, because we're in a profession that's part of lifelong learning. And that's a common theme that we're going to have, that we're going to talk about, lifelong learning. And I think this quote actually kind of sums it up. Learning is never cumulative. It's a movement of knowing which has no beginning and no end. Lifelong learning. So this is one reason to do a residency, because it's part of what you guys are going to be naturally doing within the profession. Okay? Number 2. Who has number 2?
Hi, I'm Jill Young. I'm a third-year student and I'm from
Bottom. So you said Jill, right?
Yeah.
So, Joe. So, can you answer this first question? What's a documented cause of root canals failing to heal? Documented cause of root canals failing to heal. Reinfection. All right. Anyone else? Can you add to that? Reinfection. Missed canals. So we heard from the third year, fourth year, and second years. What else? What else?
I said operator malfunction.
Operator malfunctions. Yep. Perforated canal. Right. Which can happen. I've done it. But I'm surprised no one said anything about paper points. Paper points. Not necessarily leaving them in there, but there's some evidence-based dentistry and some documentation that has shown that the use of paper points, if the cellulose fibers in the paper points can carry bacteria to the apex, it's going to make this periradicular area just constantly inflamed, right? And also those paper points can get lodged in there and remain there, which is going to cause chronic infection. So who in here knew that or had heard of that before? Okay, you read an article about it? Stephen, of course, yes, he knows. Yes. But I'll be honest, I didn't know. I've been practicing for 20 years. I had no idea. Which takes me to my point that you don't know what you don't know until you encounter a situation where you then realize you don't know it. Right? And it will happen when you leave here after graduating. You guys have a great foundation here in Maryland. It's a great school, top 10 in all the schools throughout the country. But yet, it's just not enough. You guys are not going to know everything. I've been practicing 20 years. I had no idea anything about paper points still causing periradicular chronic infections. All right? So this is going to happen to you. But by doing a residency, we want to try to mitigate and decrease the things that you don't know. But that's why you do a residency, to continue to find out and learn and determine what you don't know. Because right now, you guys don't even know what you don't know. Right? So, second reason why. Number 3. Who's got 3?
Yasmin.
Hey, Yasmin.
Here.
Baltimore, too?
Rockville.
Oh, Rockville, PG County. 270, right? All right, have you heard of this movie before?
Yes.
Yeah? Tell us a little bit about the movie.
I haven't watched it, but is it with Tom Cruise?
It is with Tom Cruise.
That's all I know.
Okay. So, briefly, this is Cuba Gooding Jr. He's a professional athlete that's being sought out by this agent named Jerry Maguire. But he doesn't want to give Jerry Maguire his business. All right? So, in this scene, he is playing a game with Jerry Maguire to see how he can test and see how far Jerry Maguire is what he's willing to do to get his business. All right? So, insert Tom Cruise. Jerry Maguire, he plays Jerry Maguire. Cuba Gooding Jr. has him say, repeat after me, repeat after me, repeat after me. And Tom Cruise goes on this rant. Show me the money! Show me the money! Show me the money! Well, this is what you guys are going to be doing as it relates to money. Because when you do a residency, you're going to be getting paid. This will be the first time, and probably the last time, you're going to get paid to learn, to develop your skills. Right? First and last time. So, a good reason to use the year, or maybe 2 years, to develop your skills, get paid to be able to do that. Because what happens when you leave here, when you leave residency, it's very difficult to obtain continuing education and have time off and get paid for that also. And we'll talk a little bit about that in a couple of the other slides. So, number 4. Who has number 4?
That'll be me.
That would be you. Now, what's your first? Okay, go ahead. I'm sorry.
Okay, so my name is Alicia, last name Moore, from Lynchburg, Virginia.
Lynchburg?
Lynchburg!
Wow.
Please don't start.
No, I'm sorry. Just an aside. My
know where that is.
See?
Relevant.
Connected.
Went to the University of Virginia for undergrad, and then I'm a third-year dental student.
Awesome. Awesome. So, here, you said Alicia?
Alicia.
Alicia. So, are you a member of any, besides SNDA and maybe one or two other organizations, are you a member of any other organized dentistry student chapters here?
I'm a part of ASDA.
ASDA. Okay.
And AGD.
AGD. So, you are a member of AGD. So, let's talk about that. One of the things that's nice about doing a residency, especially if it's a GPR or AGD, is that you get about 30% of your required credits towards a fellowship status in the Academy of General Dentistry just from doing an AGD. Or I'm sorry, just from doing a residency program. All right? Fellowship status is basically a designation that's given to about 10 to 12% of all dentists throughout the U.S. And it's a credential that you can actually use to market to your patients also. It just signifies that you're dedicated to outstanding oral health care, continuing education, and lifelong learning. Okay? So what's nice about the AGD and as a resident, by doing a residency, you're going to get about 150 to about 200 of the credits that's needed for your fellowship. You need 500 actually. The fellowship standard, you have to have 500 hours of continuing education, 5 years of continual membership, and you have to take an exam. It's about 200 or 300 multiple choice exam, and then you have your fellowship. Okay, but normally, if you were not doing a residency, it's going to take about 2 or 3 years, maybe a little bit longer, to accumulate that same amount of credits. So another reason to do a residency. When I left here in Maryland, I was like a CE junkie. All right, just like now I'm a Starbucks junkie. CE was my thing. A lot of it had to do with the fact that there was a gap between what we were learning here or what we had access to learn here and what I wanted to do. So CE became an avenue to kind of fill in that gap. All right? So that's one thing that's nice about doing a residency. The speed at which you accumulate these credit hours, and additional to that is being able to being in a program. You're going to have a lot of education, a lot of exposure to different types of dentistry. Bless you. All right, so where's number 5?
Number 5.
Number 5, my man in the front.
All right, so I'm Sheun Otola, also known as Sean, from Richmond, Virginia.
Richmond, Virginia.
Yeah.
Okay.
Second year dental student. I went to VCU for undergrad.
VCU.
Yep.
Awesome. So, question for you. What's your first name again?
Sheun.
Sheru.
Sheun.
Sheru.
Sheun.
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 Sheru.
Yeah. Yeah.
All right, so you know the answer to this question. What's the average of the median salary in the U.S.?
I'm gonna go with 46,000.
46,000 is his answer. Anybody else want to add to that? Anyone else have a different answer? 55. Okay. 35. So 46, 35. All right, back row, we got another number. 57. So this is average median, the median household income in America. So we have 46, 35, and what? 57. So it's actually 47. 47,000. So I got something for you because you're real close. You're class of 19, right?
Yeah. Cool.
47. Well, wait a minute before I give it to you. Hold on. There's the second part of this. All right, it's the second part of it. Now, what do you make now as a D2? Zero, right? You guys are actually it's negative. It's not even zero. It's worse than zero. So one of the things that's nice about doing a residency, most of the programs, you guys are going to be receiving a stipend or a salary for that year that you're going to be there as a resident. And it's going to be more than the median household income, right? Also, what's nice is that you guys are going to be have access to some benefits and some paid holidays and vacation days. All right. I know you guys have vacation here. You probably have some benefits as a student. But once you leave a residency and go into private practice, these benefits have a dollar value to them. These holidays, usually what happens when you're working in private practice, you're usually paid a per diem, $500, $600 a day, or a percentage of production. But how much do you get paid if the office is not open? Zero, right? That's just how it works. With the residency, during the time that you're a resident, you still get paid. Right? You get paid for those holidays. At Bronx-Lebanon, the residents they're entitled to 8 holidays that are recognized by the hospital. They get 4 weeks of paid vacation. All right, he's smiling. He's like, we also get some time for educational leave to go do some CE. We also get time for board leave also. Take boards, things like that, okay? All of which, when you get into private practice, if you're not in the office, you're not producing, you ain't getting paid, okay?
Oh, thank you.
All right, who has number 6? 6. 6?
Number 6.
It's not 9.
Did she leave?
Reading is fundamental.
I don't know. We might
Dr.
have to
Morgan.
switch it in a minute. No, that's not.
Dr. Morgan, you have 6?
Who has 6? No? All right, someone take 6.
Dr. Morgan.
4th years. You'll take 6? Okay, what's your name?
John.
John?
Upload 6.
All right.
My last name is Chinbu.
Chinbu.
Hey.
See, I said that. So, student Dr. Chinbu, have you heard of this game before?
Yes.
Monopoly? How do you play Monopoly? What's the purpose and the goal of Monopoly?
It's buy houses.
Buy houses, buy property, what else?
Someday.
If you don't put that rubber dam on it, it goes down in the road, you go to jail.
I get stuck in jail a lot.
Oh, that's not good. That's not good. That's not good. That's not good. Well, one of the things about Monopoly, if you guys don't know, is it's a board, and every time you go across this go, you can collect $200. You get paid, right? Typically, as a dentist, you have to pay out. You got to pay off your loans and things like that once you graduate, right? And for most people, it sounds like it's going to be close to $300,000, $400,000. I bring it up because what's nice about a residency is that you're able to defer those loans for a period of time. It's not, it's not going to be forever, but it will give you some time to pay off some loans, 18 to 30 months, while you're figuring out your master plan in your career. But also, what's nice is some of the programs where you'll be at as a resident, if you decide to stay on as faculty, some of the residency programs will have what we call a government distinction or designation as a federally qualified health center. And usually those are designated to locations that are serving the underserved, basically. And one of the things that you're afforded to, you have access to as a resident, not only will you have some curriculum or some people that will come in and talk to you about some different options on how to defer your loans or how to stage payments and things like that, but also if you decide to come on as a faculty member afterwards or some point, even after 5 or 6 years after finishing your residency, you may qualify for one of these loans where they'll give you, not only will you have a salary, but they may give you $30,000 or $40,000 every year for the next 3 or 4 years. So, say if your student loans were about $360,000, if you're working a 4-year contract, you get $30,000 a year. 4 times 30 is $120,000. So, about 1/3 of your loans paid off. It's not all of it, but it sure enough beats 0 thirds, right? So, just something to think about in doing a residency, as relates to where you do your residency and being able to defer those loans, give you some more time. Okay? Number 7. Number 7. Oh,
You or them?
huh?
Am I speaking to you?
I'm speaking to all of us.
Okay, I'm Jasmine Waters
Jasmine.
from Landover, Maryland.
And
My second year, and I went to a lot of schools. Went to Temple first, and I graduated from Virginia Commonwealth.
Okay. So I'm sure that you see your school, you see our school up there, right? So this list here is cool because it represents, at Bronx, Lebanon, it represents all the schools where we have residents that have graduated from these schools. So if you look at the list here, pretty diverse as far as location. We actually have some residents that are from Canada, Montreal here, West Coast, Puerto Rico, so kind of spread out. To me, I think this is one of the strengths, at least of our programs, and probably maybe some other programs that you'll find, is that you have a diverse population and perspective. So this is another reason why to do a residency, because the ability to network and learn from other colleagues with diverse backgrounds and training. And then in addition to that, you're going to be receiving some one-on-one mentorship with some of the faculty members. Awesome. But to my first point, as it relates to interacting with colleagues, that's part of your learning experience too in a residency. Not everyone can cut the preps like we do here at Maryland, you know? All right. Not everyone can take the teeth out extractions and suturing like we do here at Maryland, right? But there'll be some other things that you'll be able to collaborate with your co-residents and learn from, all right? So that's very, very helpful. In addition to that, one-on-one mentorship. Depending on what actual program you go to, you'll have faculty members that have a very broad experience, varied experience, whether it be private practice, owning several practices, military experience, etc. But what's nice about it is that this right here, you get this one-on-one. Now, last time I checked, I know both here at Maryland and other schools, usually there's like one instructor to like 15 student doctors, right? One thing that's nice at Bronx, Lebanon is that we've got 29 GP doctors. We have 5 orthodontists, 5 oral surgeons. We have about 6 or 7 pediatric dentists, 2 periodontists, and we also have 1 endodontist. So if you add those up, it pretty much almost equates to the same. It's the sum of the number of residents that we have. We have about 38 residents. So 38 residents, 30 plus attendings that have some interaction with the students, almost like a one-to-one. So there won't be a lot of you waiting, or you're here and there's a line of 10 other people waiting to see that same instructor. It's going to be you and me. We're going to be working with the case together. You'll have that one-on-one mentorship. We also have a mentorship program that some programs may or may not have. But that's important because this is a time where you guys are going to be learning a lot. Right? So it's good to be able to be in a program or be in an environment that's going to help you jumpstart a lot of your careers, a lot of the things that you guys are doing and learning here. All right? So speaking about faculty members and mentorship, who has number 8?
Hi everyone, I'm Ekpa. I'm a D3 and I'm from Lagos, Nigeria. And I went to College Park.
Hey. Okay, cool. So, are you interested in specializing?
As of now, no.
No? I've had enough, Dr. Hayes. I'm just trying to get up out of here in 795 days.
But I'm open-minded.
You're open-minded?
It's 13 months.
Okay. All right, cool. Anyone else interested in specializing? It's okay. You can share. I know Dr. Cross is. Yes? What specialty do you think about? Ortho. Okay, so ortho, that's up there. Pros, Dr. Cross, I don't have pros up there, but I'm going to have to add it now because of you. Anybody else thinking about specializing? Just don't want to tell anybody, huh?
I am interested in public health.
Public health? I need to add that too. Making me work. So, public health, ortho, pros, but these other ones, these ones here that I have up top were pretty much the 4 that are the most popular right now as far as the number of applicants. What's nice about a residency is that you'll be able to interact with these specialists. And these specialists not only are going to help you with your clinical dentistry, but they can help you with your future. All right? How are they going to do that? Because in residencies, you're going to have rotations and comprehensive care experiences that are going to add value and content to your programs, your applications that you're going to be applying to as for specialty. But also, they're going to help you with coming up with a portfolio. I call it a portfolio of cases that you're going to be using to go out for jobs. One of the things that that I emphasize with our residents is that they need to document the cases that they're working on, especially endo, and also document the volume of extractions. In private practice, three things people are going to ask you as far as your skill set and what you're comfortable with are what? What do you think the three things private practice? Endo, second molar. So endo, right? How comfortable are you with rotary endo? How long does it take you? Right? Just one patient. It's not going to be 3 hours. Right? What else? What's the second thing you think most of us as employers are going to ask you? Extractions, right? How comfortable are you with surgical extractions or even third molar extractions? And what's the last one?
Crown prep.
Crown prep, yeah, you'll get there. How long does it take you to do a crown prep? What else? There's another one. Everyone in this room was one of these, probably about peds, yeah, about 10, 12, 20 years ago, something more. But peds, do you see children?
Yes.
Right? Yes. So, doing a residency, you'll have some rotations in those areas that we talked about. You'll have some comprehensive care experiences in these areas, but more so that you can develop a portfolio of cases. I tell all the residents, especially the ones that are interested in applying to endo, you need to be documenting each and every case, a root canal case that you're doing. Do it before, pre-op. Write down some notes as far as your clinical findings, any challenges or things that you had with that case, and then also take a picture of the post-op, right? And there's so many platforms that are out here now that you guys can create. You can drop pictures and drop narratives and have a sheet that's just, one of your endo cases can be an electronic file. So that when you go out on interviews and you're sitting there with the owner of the practice, you can show them your cases. You have something that's going to help you differentiate yourself from other candidates. Also, same thing as relates to those of you that are going into specialty programs. All right, using that portfolio and those procedures to add to your credentials, so to speak, to help you differentiate yourself from all the other candidates. And it's really, really important to do. Namely, because of this slide. If there's one takeaway I want you guys to have today, is the information that I'm going to briefly go over about this slide. So we have pedo, ortho, pros, and GPs. So we're going to do pedo since Dr. Chitty's in the front here. So this is your competition, brother. It's right here. Close to 11,000 applicants. Of that, they're only taking about 450. So we're talking about 4%. 4%. So you're fighting for about 77 positions throughout the country. I'm sorry, at a number of programs. So divide the number of programs by that. Each program has about 5 to 6 slots. So from here to get to here, you've got to be different. A lot of these programs want you to have some GP or GPR or AGD experience. All right, so everyone's not going to be number 1 or number 2 in the class. Everyone's not going to have a perio, pedo. Was it clerkships? You guys still do the clerkships here? Yes. Everyone's not going to be able to get into the clerkship. So you've got to figure out, if you're thinking about applying to specialty programs, how are you going to differentiate yourself? A lot of these programs, like I said, even ortho, even oral surgery, they want you to have some more experience. Because right now, what's the requirement? We're the 4th years. What's the requirement for endo? 3.
Oh.
Is one of them a molar?
Yeah.
Oh, there you go. It is a molar.
You can choose to do a molar.
It's optional. So one of the 3 is a molar.
You can choose.
Okay, so how many have done molars? Show of hands. Molars, not pre-molar molars.
No.
Okay. Okay, so one. So we have one person. So going into private practice, doing one molar root canal. But going into a residency program, you're going to probably not only do more than one, but you're also going to be seeing a higher volume of patients. Because I know right now, it's still for the D3s and D4s, was 2 patients a day, maybe 3, 2, 2.5. As if they show up, right? In residency, most programs, I know in Bronx, Lebanon, you're looking at 8 to 12 patients a day.
Sorry.
8 to 12 patients a day. So with that experience and that exposure, that gets you ready for private practice. Gets you ready for real work. Hold on one second with your question, if you would. All right. So keep in mind, this information is a reason why you have to do a residency, or it's a very good idea to decide to do a residency, so you can add to your credentials to differentiate yourself from here to get over here. All right. Even for those of you that are just doing GPR program, I mean, look, it's a little bit higher, but not that much. Right? Not that much. Also, most employers want to partner with people that have some more experience. Students or residents or recent graduates, new dentists that have more experience. All right? The example with the root canal, just having one experience with one molar. That's probably not going to cut it in private practice. Extractions. What's the requirement for extractions? 10. And that's between D3 and D4, right? Yeah. In residency, you'll probably do 10 in 1 week. If you're on a 6-week or 8-week rotation, you do at least 10 in 1 week. So, again, having that experience, being able to go into a job interview and say, hey, I did a GPR, and I've done over 80 extractions in over a 6-month period. It's much different than 10. Again, something to think about. Okay? All right, who has number 9?
Hi, I'm Janine. I'm a second year from Atlanta, Georgia.
ATL. Where'd you go to high school?
Galloway.
Galloway. Where's Southwest?
No, it's like
Central. Okay. Cool. Second year, right?
Yeah.
Okay. All right, so Janine from Atlanta, Galloway High School. What is a PAP? What does PAP stand for? Periapical pathology. That sound about right? Yeah? That sounds about right. Well, for today, it stands for personal and professional development. All right? Guys, this slide is probably the most, one of my favorites, and probably the most important. This is one of the things that you're going to really benefit from by doing a residency. You guys are going to learn so much about yourself, about what your shortcomings are, what things you like, what things you don't like. You know, it could be endo, it could be those surgical extractions. But you're going to learn how to break down those barriers. Also, you're going to learn how to interact more with patients, right? When you leave here, there's a difference between the patients you see here and patients you see in private practice. No longer are those patients named after the procedures that you have to get done for your requirements. You know, it's not Miss Jones, Miss Jones, oh yeah, Miss Jones, upper denture, yeah, denture Jones, yeah. It's not that anymore. It's Miss Jones that's calling your phone, and she's got an abscess, and she's constantly calling you, and she's got a face, she's got a personality, she's got a job, and everything else. So you guys will learn how to interact with those patients, getting them to say yes to treatment, and helping them and developing those relationships. All those things take time. And you guys have limited time here at dental school. All right? Because it's just 2 patient encounters every day. Again, if they show up. All right? Did you hold your question? Just write it down and hold your question. One of the things that we have at Bronx Lebanon is we have a program. It's a HRSA funded grant and oral health leadership development program. We kind of help you all we help to develop you all as leaders. Now, you guys are already leaders. You guys would be here at the school if you weren't in some leadership capacity even before you got here. But one of the things that we do at Bronx Lebanon, they may have it at some residency programs, is we're going to give you some more exposure to leadership as it relates to private practice, as it relates to interactions with not only patients but staff. All right? Because one of the things that you guys will find over the years is that the dentistry gets real easy. It's real easy to do. It's the patients, it's the staff, it's the regulations that become a pain in the... So learning how to navigate or how to mitigate and sift through all that is some of the things that you'll learn about. We have experts come in from practice management and are consultants also. All of you in our program are assigned a mentor. It's going to work with you with 5-year plan, 3-year plans, 5-year plans, 10-year plans, all of that. Typically, a program like this, if it's not in a residency, you're looking at probably about anywhere from $8,000 to $12,000 of your own money that you have to pay for to get these leadership and training skills. All right? So, again, personal and professional development go hand in hand. Personal growth, I don't know if you guys have heard of Jim Rohn before, but he's known as the godfather of personal development. Of all the things that have an effect on your future, I believe personal growth is the greatest. We can talk about sales growth, asset growth, profit growth, but all of this probably will not happen without personal growth. Personal growth. I know right now it's kind of hard for you guys to be thinking about personal growth when you got patients, you got exams, you got boards, you got requirements. But as you develop and leave here, at stage 2, you guys will start to continue to grow personally. You have to pour into yourself and learning different things about yourself and how you relate to other people. Practice does not make perfect. Practice makes you better. It makes you better. So again, that's the reason for doing a residency. You're going to be practicing, honing your skills, seeing more than 2 patients a day, right? So we've talked about education and learning. We talked about the 9 reasons. We're going to talk about the rest of these, and we're going to wrap it up. So this is probably one of my favorite quotes as relates to education, teaching, and mentorship. Tell me, and I forget. Teach me, and I may remember. But involve me, and I learn. Involve me, and I learn. So, as a mentee, or even one day as a mentor, your interaction with people is key because it can change someone's life as far as learning, being involved, and being involved with them, but also making them be accountable for their actions and their growth. So we talked about the 9 reasons. So, again, why are we talking about this? Why is this important? Because of you guys right here. The future is limitless. But I also want to make sure that you guys become the best you ever. All right? That's key. It's hard out here when you guys leave school. It's totally different. You won't even know the challenges that you're going to have. All right? Most of our learning comes from out of our failures, not from our successes. I think that's pretty true. You learn so much more when you don't necessarily reach your target or your goal. Makes your drive go up, makes you more ambitious. Okay? To succeed, you must fail a few times. But do not fail yourself into thinking that residency is optional. All right? Don't fail. Don't think that it's optional. It's not optional. All right? Success comes to those that plan and do. The action of doing is the most important indicator of your success. One of the things that over the years, the last 5 or 10 years, is I always have a lot of great ideas. Right? You write them down on a piece of paper, you put them on your phone, you type them up on your laptop. But all of that doesn't mean anything if you don't execute. You don't execute and get the job done, so to speak. Right? So, in doing such is key and is a link to your success. Do. Execute. Get it done. So, that leads me to my call to action for all of you, except for the D4s that I know I'm going to be seeing in July. Do a postgrad residency. All right? Oh. Do a postgrad residency. It is not optional. It's not optional. Hey, there's some faces in there. It's one of my favorite pictures. All right, so now I want to take some time to. Is that you yet?
There we go.
You didn't have the video. I
didn't. I'm not that day.
So I want to take some time now to kind of open up the rest of the talk to questions you guys have, whether it be about residencies, about plans after dental school, or as it relates to what you can do now in preparation for when you walk across the stage like Tara, all right? 795 days or 394 days.
29.
Oh, what is it? 29. Excuse me, 29 days. But you guys have your plan of action, so you guys are covered. We want to get these other folks covered and planned. So questions you had? I'm sorry, I didn't get back to you. Let's get to your question.
All right. So you said post-grad residency is not an option. I like statistics. I mean, from your numbers, it seems like 1 in 10 for GPR. I think everyone in this room. No one raised their hand for specialty. So I could assume like 1 in 10 people in this room would get into a GPR, right? So possibly you're saying it's not an option. So indicates that it doesn't happen for you. What do you do?
What, as far as not
like a general practice residency?
So there's some D4s right now that you know of, that I know of, that are not doing a residency because maybe they didn't match. So I think what they typically do is that maybe they'll work somewhere for a year, right? But where you work really is gonna dictate your first 3 years out of school, what you learn. Not everyone, like a Dr. Morgan or Dr. Hayes or some of the other alums that you guys have had some interaction with, are actually going to be interested in your future, your growth. They see you as how many root canals can you do, how fast, how many extractions, what can you produce. And if you don't hit that target or that number, next. So it's key in being able to find the right location. And quite honestly, it can be hit or miss. Even with the residents that we have that have done a 1 year residency, even 2 years, I always tell them that you want to be thinking maybe having 1 or 2 places after residency that you work at. So you get a feel for different offices, because every office is not for everybody. Everybody's not for good in every office. So one plan is to, and this happens across the country. A lot of people are going out working in corporate practices. And just because it's a corporate practice or a DSO does not mean they are all created equal, because they are not. There's some ones that are really, really good and some ones that are just horrible as far as you learning and maturing professionally. So in some cases, we have some people that apply for the GPR after they've been out for a year, maybe. And that's always an option too. Again, this is just my personal biased opinion. I haven't run the statistics on the number of graduates that are coming out, like say last year. What number of them do residencies? There is some data on that from DIA as to where they're going as far as what percentage are going into private practice, DSOs, residencies, etc. Good question. Someone else had their hand up.
Oh, no, I just wanted to make a comment about saying that we only see 2 patients a day.
Yes.
If they show up.
If they show up.
We could see 4 or 5 patients a day.
by the time I set up, get myself set up, make sure I'm all control, I stay in line, get some practice studies, go get a laptop, and often I've been locked out. The business office manager, and she's at work, and
You take this one.
go back downstairs. By the time I start 1:20, and she's walking, she goes to the bedroom, and I have to stand in line, and try to walk ahead of me. Oh no, we got office today. Well, what's
Well, look. Was that a question or a comment? Because I'm so glad I'm not here, and I'm going home because I don't know if I can answer all that.
I'm not fast, but I think I can see what it is.
So here's the deal. When I was here, there was an assisting school or program or something.
It's gone.
It's gone. All right. Well, hey, you guys are spoiled. You guys are too fancy. All right. When we were here and we had assistants, everyone from other schools were like, "Y'all have assistants?" Oh, that's real fancy, so to speak. So, yes, you probably could see more patients if you had an assistant, but that time is coming because you may wish for more assistants, but not all assistants are created equal. There's some assistants that have been doing that for 20 or 30 years, and they'll be sitting just like this, wanting you to do all the work, and you're paying them, or the office is paying them to assist, and they're not assisting. So be careful what you ask for. But one of the things that's nice about a residency, it is a requirement for CODA to make sure that the residents are not doing the duties and responsibilities of auxiliary staff. Assistants, not doing things that the front desk has to do as far as making appointments, financial arrangements, and things like that. So when you're looking at programs, when you're going to visit programs, that's something that you want to ask, because you don't want to be like you're here, stuck here, doing the treatment, breaking down the room, setting up the room, and you got 1 hour to do all of that for the next patient. All right. So good comment. I think. Any other questions? I got some questions.
Sure.
Yes. Real loud. If you I'm sorry, I'm just battling with this.
If you're interested in general dentistry, do you apply to a GPR and AGD, or just like one or the other? I don't know how
Both. You can apply to both. Yeah, we have a lot of candidates that apply to different programs. Now, GPR, AGD. Similarities, differences, real quick. With the GPR, it's usually hospital-based program. AEGDs are usually school-based program. And some schools have a GPR program that's affiliated with it. I know we used to have it. I don't know if we still have it or not. No, but it's AEGD programs. So that's the first difference. The second difference for GPR, there's two major rotations that you have that you don't have in the AEGD program. They're anesthesia and family medicine or emergency medicine. In anesthesia, that's when you have a 2-week, it's an 80-hour, 2-week minimum, where you go to the hospital and you work with the anesthesiologist. You guys are learning how to do IVs, start IVs, learning how to do intubations, both live and also on simulators. And you guys will be working with the anesthesiologist and maintaining an open airway. That's your job for the 2 weeks that you're there in your training. The second rotation is family medicine or internal medicine. You guys will learn how to do H&Ps, which are histories and physicals, physical exams. And that's usually 2 weeks also. All right? So that's the second difference. I don't think of anything else. But no, to answer your question, we have a lot of candidates that apply to both programs. It all depends on what's on your list. Some locations that you may be interested in going to, and moving back to, or just being in, they may only have an AEGD program. Right? One other tip that I would recommend for you all, in the class that's graduating and in the class that graduated before you, before these current D4s, you have a plethora of information as to different programs they've applied to and also gotten into. So one of the things that I recommend, and this might even be a project for the SNDA chapter, is to develop a roster or a roll call of all the graduates from the last 5 years and what residency programs they've gone to, because that's a direct link to you all getting more information about these programs that they're at. Because unfortunately, there's not a guide to residency programs. There is, IDEA does have what we call, there's a website, and all the programs that are accredited programs have to list some general information, but all the programs don't have websites where you can go to and find out about it. So if you have a link to a particular program from a previous colleague or classmate or something similar to that, that's a great resource for you all to find out more about the programs, okay? Which is strongly and highly recommended. Because that's how you start to make your list. Has any of the D3s started to put together a list yet of possible programs if they're interested in programs? So good. Was that your hand up yes, or you had a question? Good. So that's good. I mean, it's never too early to start, primarily because between this, between your D3 and D4 year, it's a great time to go visit some programs too. Because, again, the things that you see on the website is only a small drip in the cup as to what the program is really like. You want to go and meet the program director if you can, meet the residents, talk to them, see what the environment is like, what it looks like, because you want to see if the program is something that you're interested in, if it's right for you. All right? But you can't do that sometimes just online. So if they're close by, great. Jump in the car, go visit. If they're a little bit farther away, you may have to kind of coordinate a little bit better. But definitely recommend going to visit the programs. As a program director, when you guys come and visit, who else came to visit? But just as an example, it does one main thing primarily, which is show that you are interested. All right? And we will remember your face. It's like we can't forget that face right there. He came to visit during the summertime with his interest in pedo. And again, a lot of the programs and program directors, they don't know who you are until they get this. Right? And this is not warm and fuzzy, typically. But your face, your personality, your tone of voice, your eye contact that you're making with people that you meet, it's totally different. It kind of starts to set you apart, differentiate yourself from all the other candidates. Because for their class that's coming into Bronx, Lebanon, we had close to 200 applicants. It's a lot of paperwork. It's a lot of folders to look at. What you want to be concentrating on is how does your folder pop out from that list, right? Because you're trying to get an interview. So going to visit the program may be helpful. Because now I know I might write a note and say, oh yeah, she came to visit in July. So, good strategy to do also. Good question. Any other questions? Some of you guys have some questions. I don't have any old tests, so I can't give you the answers. I don't think I do. We still have a Big Brother, Big Sis program? Yeah. Is it helpful or not really? Absolutely. Don't say that because Dr. Morgan is here.
We're getting all the mentors this year.
Getting all the what?
All the mentorship this year.
Good. That's cool. That's good. Any questions from the D2s? I know this is not really the ideal time as far as what you guys are going to be working on the next 3 months. If you guys are trying to finish up with your exams, you guys are going to be transitioning in the clinic. But the D3s, this is your time right now. This is your time. You guys got the past applications for residency programs open up in about 28 days. I think it's May 17th or something like that. Yeah, that's when it opens. That's not when you have to submit everything. But I'm just saying, that's when it opens up. Early is better. Yep, early is better. Question?
So So you apply this summer.
For some people that are doing like ortho or endo, some of those deadlines are like July 1st. So as you guys are thinking about those specialty programs, you have to, as you continue to do your research, you have to know what those target dates are. You have to start early. Any other questions? Comments?
What pops out at you, like in an application? Like, what is something that you find like intriguing? I know everybody's application is different. But,
Yeah. Well, I like telling stories. Myself, I have a lot of stories. So I tend to look for stories, right? Because again, all we have is that piece of paper. So we're trying to make sure that personal statement tells a story, tells more about you. One other tip that I'll give you is that one of the things that a lot of people will do is, usually on those applications, for the past applications for your personal statement, there's usually 2 sections. Did you guys know there's 2 sections in that personal statement sheet? So you didn't even know. Did you know there's 2 sections? There's 2 sections. There's a section that probably covers about 85% of the sheet, and then there's another section that covers probably 15 to 20%. And that bottom section says, what additional information do you want to supply to, want to say about yourself? I would say less than 90% of less than 10% of the people, the applicants that I see, do not write anything down there. So when I see it, I'm like, hey, use that full sheet of that application, of that personal statement, and fill it up. I know it sounds corny, I know. But what happens when you start looking at 200 applications and you're looking at the personal statements of all those applicants, after a while, everybody's saying the same thing and it looks the same. Whereas that last 10%, that last part of the sheet is different. It is blank. Fill it up. I'm serious. Fill it up. That's just my approach. If you ask 5 other program directors, they may tell you something totally different. But that's one thing. But also, we want to know about your interests, more about you, and how you're going to contribute to the program. All right? How you're going to contribute to the program. Somehow infuse that into your personal statement. We already know you want to become a dentist. Maybe some history about how you got into dentistry, how you made that choice. I mean, that's in everybody's statement. But tell a story. Talk about a little bit maybe about your plans after residency. How you want to use residency to catapult things that you want to do personally and professionally. All those things are important. All right?
Yeah, I just had a quick question. Yesterday I attended an ASDA meeting.
You went to an ASDA meeting yesterday?
Yeah, ASDA meeting. They were talking about how they were phasing in a new test called the ADAT. And
it's already phased in.
Right. Sorry, already phased in.
No, that's okay.
But what is the Bronx Lebanon stance on that, and what systems they put onto it?
So the question is, what's the impact of this new exam called ADAT? Right? That's your question?
Yeah.
So last year was the first year that they rolled it out. And probably to the dismay, I mean, they did some surveys. I'm not sure if they did any surveys with the students, but they did ask program directors whether or not they were going to be utilizing it as a requirement. I know at Bronx Lebanon, we said, nope, not a requirement. Now, some specialty programs, they're using it because there's been a lot of changes in a lot of the dental schools as far as the issuance of a GPA, class rank. A lot of the things are now pass-fail. So all the tools that program directors and schools used to use to sift out that pile of 200 applicants down to maybe 10 or 15 that are going to interview, they don't have them anymore. So like oral surgery, endo, and ortho, typically has been class rank and GPA. But if you got 10 or 15 schools that are now just pass fail, how do you differentiate folks, right? So that's one of the reasons that exam came about, to help programs, post-grad programs, and being able to have some other tools to kind of evaluate candidates that are coming into their program. Now, we had something interesting this year. Again, this was the first time that the ADAT was offered. And we also have a pedo and an ortho program. Ortho, I think both programs. Ortho, I know was optional. Pedo was mandatory. And guess what happened? What do you guys think what happened? Huh? Less pedo applications. So applicants that would have normally applied to Bronx level, I say it's 300. I don't know, it may not be that number, for 6 spots. Didn't apply because it's another exam. It's more money. I'm not taking that. I don't have no money. I just applied to 20 schools. I don't have any other money. So we saw a dip in the number of applications, which was maybe good or bad, depending on who you ask. But so that's the effect of it. So some programs, it continues to help weed out the number of people that are going to be applying. One thing that's unique about oral surgery, and I know no one really put their hand up about oral surgery, is that oral surgery kind of created their own exam, where they use, Someone knows about it? What is it? Yeah, they have a. Yeah, they use a model, an exam from the medical, like the first 2 years of medical school, but then they modified it for just it's an exam that they use just for OS residents or residency, right? So for them, they've kind of already said, well, we could care less about an ADAT. We have our own exam that we're utilizing, that we're using to benchmark and see where candidates are on that exam. So that's a whole different exam. But that is something that you guys have to take into consideration of those programs that exam is mandatory and those that are not. Also, another thing you have to keep in mind that there are some programs that are part of what we call match and some that are non-match. Match is basically a candidate and residency program selection process where you as a candidate, you may have 5 schools and you have to rank your top positions of all those schools. Where your number 1 is, number 2 is, number 3 is, number 4 is, etc. Now on the other side, the programs will rank the candidates where they, who they wanted their programs, maybe 1 through 50 or whatever it is. And then what happens with match, those lists come together via a computer and a logarithm, and then what happens is that you get selected at a particular program. It might be your first choice, might be your second choice, might be your third choice. And that's what the match is about. But there are some programs that don't participate in match. They have their own selection process. Whereas you interview one day and maybe 3 weeks later they are giving you an offer. Or some programs, some specialty programs, it's the same day. They want an answer right now. Which has caused some problems with some of the residency programs. So that's match. That's another thing to keep in mind. All right. Do you guys have like a seminar here through the school where they, as D3s or D2s, they have someone that comes in and talks about the whole application process with the DIA and everything? Good. Because you guys are lucky. There's some schools where they don't have it. They don't have it at all. But it's a lot of information to learn. Some students will have to just kind of figure it out by themselves. But it's also very helpful to have some type of structured seminar, a presentation on how to fill out the application, what the application contains, how to get your letters of recommendation, all those types of things. So, anything else? Any other questions? Well, if you could please, if you haven't already, please fill out those evaluations. It's very helpful for me to kind of get an idea of what you guys want to hear maybe more about, some of your concerns. Maybe you guys will have me back. Maybe we can have another lecture based on something totally different or something that's actually contained in your comments. Okay? I'm going to be around for probably about 20 minutes or half an hour or so afterwards. If you guys have some questions, I have some business cards also to pass out if you guys have some questions or want to get in contact with me. There's some contact information both on the screen and then also on my pop-up, my new pop-up. You like my pop-up? Yeah. So cool. So thanks again, you guys, for your time. I appreciate it. Good luck to you. I'll see some of you in about 28 days, the day before graduation, for the banquet. Yeah, I've recruited some of my old colleagues that are coming back to celebrate you guys. What, 18 people that graduated from SNDA that I know of? Wow. That's amazing. That's amazing. So we'll be back for that. All right, guys, that's my time. Thank you so much for having me.
So I just want to say thank you to Dr. Hayes again for coming down here. And
Absolutely.
like he said, if you have any questions, he has business cards, and then we can also take your questions and email and for you and get back to y'all. So thank you for coming.
Wait. I got class of 19. Who's 19?
Oh, that's me.
Us down here.
19. I'm gonna have a couple now. You're gonna have me back so I can pass out some more. Is you 19? All I got is 18 left. 18 Wait, you're not?
No, you're not.
It's definitely like, no, you got me doubting myself.
Yeah, wait,
I was really doubting you. I'm like, what?
Yeah, I'll get you one. Here, quick picture, everybody. All right, we're done. That's it. All finished. Great seminar. Good feedback. Good exchange of information. Hopefully everybody's happy. Right? Let's check the room. Check the room. Check the room. Check the room. Look at all these people. Look at all these new dentists up in here. Yes. All right, we're done.